sort of agenda so you know what to expect during the session this morning. So I'll cover some background, provide some context before we dive into the overview of the actual 3-year state plan that spans 2020 to 2022. You'll get an opportunity to hear from Jason and Allison as we sort of talk through opportunities to get involved with state plan implementation. We'll dive into what comes next and then hopefully engage with you all on some questions and answers to close out the session. All right, I feel like I joke with the folks in the campaign leadership around this being my jam. I feel like I'm constantly taking time to sort of just revisit the 3-year state plan. So just as a reminder to folks who've been around, who've been on this ride with us, along for the ride, we engaged in an incredibly intentional and robust stakeholder engagement process that started in 2019 and culminated in the production of the new 3-year plan, which went live earlier this year. New this year in the actual plan, we embedded guiding principles. So it's not that the plan itself, we revise and have 3-year plans and have had them since the inception of the campaign. But what we did this year that was different was we stood up 4 guiding principles to really undergird the strategies and sub-strategies contained within the plan, based purely off feedback that we heard from the nearly 300 stakeholders that we engaged over 2019. And in that time, we heard a number of things. We heard from the field that they were tired of us navel gazing at issues like racial inequity and disparities and calling out disparities in our annual reports, but not really diving intentionally into strategies to mitigate and really drive down those racial disparities. So, there's a number of strategies contained within the plan that explicitly addressed our commitment to addressing racial disparities across the state of Michigan, both through efforts that are more active, and then those efforts where we are looking to assess policies across the state, procedures and practices that perpetuate inequities that we continue to observe in our actual data through disparities. Another area, and this is admittedly where we really need to hunker down and commit to sort of building on what we know works across the state. We've pockets of the state where folks are really doing great work, authentically engaging and partnering with folks with lived experience and expertise. But this is an area where, as a state, we commit, we recognize that we have work to do, and we commit to doing that work better and stronger. And so we're looking to get beyond time-bound, single-purpose engagements and begin to authentically partner and form lasting relationships with folks with lived experience and expertise. In addition to those principles, we also heard loud and clear during the stakeholder sessions that we're not using data as efficiently and as optimally as possible. So we're really hoping that you'll see this come through in the actual strategies and sub-strategies. Our intent to replicate what works. We've used data historically to enable data matching, to prioritize folks who are frequent utilizers and emergency departments and hospitals, as well as in justice settings. And so we're looking to expand that to additional sectors to really make the best use of actual data that many of you are collecting on our behalf every day. And lastly, we included a focus around innovation and collaboration, in particular, really wanting to bring together those siloed sectors who are often not talking, to form housing partnerships with sectors like justice, child welfare, to really build on what we've seen work and be quite effective in other sectors like health and behavioral health. So now that we covered those guiding principles, I'm going to provide a really high-level overview of the strategies. So the strategy is not too dissimilar from prior state plans. We have 4 strategies. The first focused in on increasing access to stable and affordable housing. The second being focusing on ensuring system diversion and homelessness prevention. That's a new strategy for Michigan. The third, having a focus on advancing cross-sector system alignment to impact the social determinants of health. And the fourth being improving the quality of the statewide service delivery system. And I'll dive into each of those now. Don't be intimidated if you're following along on the screen and you see dense text-heavy slides. This is in large part because we're making these slides available, as I mentioned earlier, and we want to make sure folks have access to the material and that it's as complete as possible. But I am only going to hit the high points in what I share out, and hopefully you can read along or and review you can review all the sub strategies at your leisure. So under strategy number one, so this is not a new strategy, one focusing on increasing access to stable and affordable housing. We heard across all 5 listening sessions, nearly 300 people, that we still have stock challenges. We, quite frankly, do not have enough units to house folks in many communities. And so we knew we had work to do here. So you'll see several of the strategies, strategy 1A, and 1B have an explicit focus on continuing to use the state's low-income housing tax credit for unit production purposes. And where we can, and we should, continuing to use the LIHTC program to target PSH developments, permanent supportive housing developments, in areas that have high need and targeted towards populations with higher needs as well, in alignment with our statewide commitment to driving down homelessness, especially for folks with extremely low incomes and complex health and housing related needs. We're also committing ourselves to stepping away from those, right? Not just focusing in on maintenance of effort, things like using LIHTC to increase production, but we're also interested in innovation where we can. How can we explore over the implementation period, the 3-year implementation period, innovative uses of programs like ANIF for time-limited, non-reoccurring rental assistance, where that might better meet the needs of folks experiencing homelessness across the state of Michigan. We also heard through the listening sessions that communities want more support from state partners around engaging elected officials and folks representing local units of government, landlords, around introducing innovative zoning regulations, right? Engagement with landlords more broadly to offer incentives to meet those challenges with stock that many communities illuminated were issues at the local level, were elevated, were local issues. And so under strategy number 1, you'll notice there's a number of strategies where campaign leadership is committed to partnering with local communities to be a part of and support those conversations in whatever way makes the most sense to support communities and moving the dial in those conversations. Can flip to strategy number 2. So strategy number 2, small but mighty. Admittedly, this is an area where you'll hear a bit later about opportunities to get engaged with work that is already underway that we codified in the plan. This is an area where, if there's, I know there's tons of providers, there's likely tons of providers on this call and adjacent stakeholders who already know that we've been doing quite a bit in this area, which focuses on ensuring system diversion and homelessness prevention. This was a new strategy. I would like to note that this was absolutely recommended across all 5 listening sessions. Folks had concerns that we weren't getting involved early enough, that by the time folks were eligible for resources, it was too late. And so we knew we needed to double down and make a statewide commitment to intervening a little bit earlier. And the good news is we already had a number of programs that in a couple sort of pockets of the state, several communities were already testing what it might look like to stand up shelter diversion programs. And so what we committed ourselves to doing is leveraging both best practices, national best practices, and also examples across the state of Michigan to promote opportunities to expand, to replicate and scale across the state what we see working in pockets of the state. Then we hit with COVID-19 and had an influx of resources through the CARES Act, one of which being the Coronavirus Relief Fund. We'll talk about that a little bit later. So that's an example of how we've really dug in and begun to stand up statewide eviction diversion programs to try to limit inflow into shelter and prevent unnecessary shelter stays for folks so we could stage off those homeless episodes where possible. Can shift, Jason. Okay, strategy number 3, not a new strategy, instead enhancing a past strategy. This strategy focusing in on advancing cross-sector system alignment to impact the social determinants of health. We learned a lot. We have in Michigan, I think, a pretty solid track record in regards to trying to forge partnerships with housing and health, right? Behavioral health and primary health sectors. And so, yet and still, we heard from the field that there's a lot of work left to do. There's a lot of challenges being experienced on the ground. And so we knew we needed to expand and build this strategy out a bit further and stay the course here. And so you'll see many of the sub strategies contained within strategy number 3 have an explicit focus on providing support to local communities to encourage and really support the development of those local partnerships with health and housing partners that might result in prioritization and outreach and stabilization, greater stabilization of folks experiencing homelessness. And in some communities that will be standing up partnerships, and in other communities that will be deepening those partnerships and taking things to the next level. The other thing I'd like to call out here on strategy number 3 is we heard across, I want to say every listening session, that there were not the tightest linkages and relationships between the housing, the homeless response system, and providers servicing folks who are victims of or survivors of domestic violence and sexual assault. And so we knew with MDHHS's support that we could roll up a sub-strategy under strategy number 3, whereby we were explicitly and directly and very intentionally trying to forge that tighter alignment and coordination between those two sectors. And so I just wanted to call out that that is a new addition to the plan this year. All right, this one's probably the most overwhelming slide, admittedly. This is strategy number 4. This one is very intentionally dense because across all of the sessions, we heard that the field needs, in order to enable progress on any of the prior 3 strategies, we needed to double down and support the field more intentionally. So the strategy number 4 focuses on improving the quality of the statewide service delivery system. And this is another strategy like strategy number 2, where there's been a decent amount of progress, even in the midst of responding to a global pandemic. So strategy number 4 has a focus on campaign leadership, providing deeper support to COCs to really build, one, better understand what the community level needs, training needs are. So strategy 4A, sub-strategy 4A focuses on doing sort of assessment of capacity building and training to better understand what those needs are, and then bringing those training opportunities and capacity building opportunities to bear for providers across the state. We heard burnout. We heard a lot of concerns elevated from the field around things that state partners and the like can absolutely be responsive to. And so the strategies contained under strategy number 4 have a focus there. Another area where I'd like to highlight, we heard loud and clear, and I mentioned this earlier, was around racial disparities and race inequity. So under strategy number 4 is where we embedded our more intentional goals and strategies connected to advancing racial equity. And out of respect for the fact that communities are in varying points on the continuum with their understanding and recognition of racial disparities, all the way through proactively addressing race equity through actual racial equity initiatives at community level, we knew we needed to do a couple things. Begin to understand and use our data very intentionally and differently, build capacity around data and disaggregating data to really understand to what extent disparities are present across all communities, regardless of what folks may feel based on their actual experiences. So pulling out quantitative and qualitative data to really tell that story. And 2, build capacity and understanding of principles of racial equity, implicit bias, et cetera, so that the state might begin to come onto one accord with regard to our commitment and our understanding of race equity. And so you'll see there are a number of sub-strategies that focus in on building capacity and understanding, both on the data side, but then also on the strategy and just the principles and concepts of equity. Shift. Okay, so you've heard me run through at a high level the 4 strategies and the 4 guiding principles. We have our first poll opportunity. We know the plan was released earlier this year. It's been a couple months or 3 months or so since the official virtual kickoff event in August. So we would love to understand to what extent your continuum of care, your local planning body has already started to talk about the strategies contained within the plan and assessing your local efforts for alignment with the strategies under the action plan. So Jason has just put up a poll on a Likert scale, everything ranging from your community's already actively identifying strategies to move forward through to maybe. So if you can take a minute, Jason, you can probably see, I don't know if you've launched it, Jason, or if it's live right now. Okay.
Yeah, Mercedes. To that point, I launched it. Gave folks a little bit of a delay between posting the question on the screen versus launching the poll. So
Okay.
So folks have an opportunity to kind of start thinking. So the other thing that's worth mentioning is that, as Mercedes referenced, it's been 2 months since we did the kickoff. It was late August. Looking at the attendance numbers, we've got substantially more people on this call than we had on that kickoff event, although we know we shared resources afterwards. But for some of you, this is likely newer information, or you're still in that preliminary phase. And so we recognize that even in some cases, there might be some unintentional alignment between the strategies and the plan and what's happening in your community, especially when we have broad-based strategies like increasing access to affordable housing. It feels like talking with continuums and local planning bodies across the state, that's something that's on everybody's radar. So even if even if that's work is going forward, but you haven't stepped back to say like, hey, how does that align with the plan? Still like to kind of get a sense of like where, how that kind of fits in. So, oh, come on, y'all. Not even half of you responded to the poll. So I think let's give it another like 30 seconds or so. I say that, and we've got nearly 250 people on the call today. So it's not like we have a small number of people responding, but apparently that was all it took, because now all of a sudden we had a pretty significant jump in the number of people responding to the poll. So yeah, so I think let's give it another 50, and the numbers are just climbing now. So I think let's give it another 15 or 20 seconds and give folks a chance to weigh in here. So while we're waiting, hey, Tina Allen, pretty awesome. Congrats. Carla Javits Award 2020. So just got to slide that shout out in for Tina. So, all right. I think we've got 60% of our attendees have responded. I think that's as good as it's going to get. So let's end and share the results. So hopefully everybody is seeing the screen. This is kind of the breakout we were anticipating. But also, I mean, we intentionally built this question in. So, because we wanted to use this as an opportunity to kind of take the temperature for where folks are at. So 15% of you are having active conversations, which is fascinating. I kind of would like to hear, I wish we had a format where we could hear more about kind of how that's going, but that's coming later. That's kind of next steps, is we'll start to unpack some of this stuff. Nearly 30% of you are having preliminary conversations. So when we add that up, roughly 45-ish% are somewhere in process. 10% not yet, but planning to. 13% no, help us understand what that would look like. We'll get to that. And then a solid third of you, maybe, with that question mark. So, okay. So if we add up the maybes and the no's, we got about 45, roughly half who were somewhere in that gray area. So this actually is a good pivot into what's coming next with the presentation. Let's see, get the controls back. So action plan implementation, in particular, opportunities for field and stakeholder engagement. As Mercedes was saying, as we were building this action plan, it was very intentional with reaching out. There were a number of listening sessions across the state, and we took that feedback, we built a plan around it, and then for those of you who were able to participate in the kickoff event, of course, we shared that we were going to be doing a survey, and we did that earlier this month. Time means nothing right now. So a few weeks ago, we did a survey, and wherein we were asking folks about kind of their engagement with the plan and kind of how best folks wanted to hear about communication or hear about how things are moving forward and how we can, beginning to kind of tease out how we can support the work that's happening at the local level. So we did this survey. We do what we do. And we heard from nearly 80 people all across the state, all variety of agencies and placements within agencies. I think the highest response rate was from frontline staff, followed closely behind with program coordinators and program directors. So, which was awesome because that was exactly, exactly the cross section that we were looking for. We didn't just want to hear from one particular population. Wow, birds can be very loud. And so it gave us, anyway, we're just really happy that we had the broad cross section. So one of the questions, I'm not going to give highlights from all the questions. There were a couple of things that kind of stuck out. And one is that, we had these 80 respondents, and one of the questions we asked was, how many events have you participated related to Michigan's campaign to end homelessness? And, broad range, obviously, when we're trying to not have folks include the Homeless Summit, which we're obviously part of for this year. And as you can see, 50%, over 50% actually, clocked in at 0 to 1 events. And then, we've got the grizzled veterans with 7 or more events at roughly like 15 to 20% down there at the bottom. But really what it comes down to is half of the folks who responded, and we have to say like, okay, this is how social science works. We do the survey, we get a decent response rate like this. Like, there's a lot of folks that haven't participated in anything related to the campaign. So we got to keep that in mind as we're moving forward. At the other end, or on the other hand, about half of you have, with a very small portion who have done a lot of stuff with the campaign. So just something to keep in mind as we're kind of moving forward. And I think that kind of goes back to that previous poll question about kind of where folks are at. Because that's kind of reflected here with these responses. So we asked 2 questions, one about the content that folks found useful, and another question, kind of the opposite, about content that folks didn't find useful. Interestingly enough, very little feedback about what folks found not useful, which was encouraging. So it let us kind of pivot and look at the stuff that folks were kind of keen on, or kind of takeaways from the events that we were holding. And these were the convenings and kind of the in-person convenings, the webinars that have been offered. So, and here are some quotes from respondents. So again, it gives you the spread of the kind of stuff that folks were identifying. And so, okay, yeah, and ultimately this comes down to, as we're kind of pivoting from the previous action plan and the structures we had in place there to move the strategies forward to the new action plan, and kind of following up with this intentionality and continuing to to build engagement and support and kind of have this two-way street where it's, things happening at the macro level, at the state level, and things happening at your community level, and how do the two interplay. And as we're making these transitions and shifts, we wanted to make sure that we didn't just throw everything out. And that was why we were asking, what did folks find useful? So another question, and we've been asking this pretty consistently at the kickoff event. For those of you who are there, I think the question was, what pieces of the plan resonate with you most strongly? So now it's matured. The question has moved into what parts do you want updates on? And then there were some follow-up questions about, well, what do those updates look like and how regularly do you want them? So if we kind of look at this and say, and this is one of those questions where folks could pick all of the things, or they could pick none of the things. And looking here, so that first green bar across the top is increasing access. That's strategy 1. And then you got strategy 2, strategy 3, strategy 4, and then we teased out the racial equity work and training opportunities. So we're seeing that, folks are interested, not surprisingly, because we know it's a huge issue. Access to affordable housing is tantamount to ending homelessness. So it's not surprising at all that that's clocking in a huge response rate. But I think some of the other things that were surprising, and Mercedes was kind of addressing that as she was going through the report, is the professional opportunities, the professional development opportunities, and training opportunities. And seeing that nearly 60% of you keyed in on that as well, and said, yeah, that's something else we want to be learning more about and we want to stay updated on. It's helping us kind of identify, and fortunately, like we already have some stuff in the works, which you'll hear about here in a few minutes, around training and around racial equity. And of course, the EDP, the ensuring system prevention and diversion. So some of the things that folks are kind of keying in on were here. So are kind of already in the process. So yeah. Anyway, well, you'll hear more about that in a few minutes. And so the last question that I wanted to highlight, or the last response that I wanted to highlight, is what is the best way to advance the strategy of the action plan? With the previous action plan, I think we had really focused pretty heavily on having kind of a coordinated, centralized response. We had different work groups, and we were having the convenings where folks were kind of reporting out. And that was good. And then the work groups were meeting in the interim. And it was moving work forward. But as we're kind of recognizing, we also want to build in opportunities for local support. So as you can see, the 3 responses are: create a centralized work group. That's the top one with the green bar. Then we've got support work that's happening at the local level with the blue bar. And then the last, the yellow bar that got the biggest response. And this is another one of those, pick as many responses as you think are appropriate. Target strategic planning conversations, either at the state or local level. And given that is the winner here. I mean, all 3 of these, there's significant responses, and obviously we need to have a hybrid of the 3. But seeing folks responding and really picking out, or really focusing in on those targeted conversations, that's part of our next step, is kind of unpacking exactly what that means. So anyway, a huge thank you to everybody who had a chance to respond to the survey. And I think now we're going to kind of transition into, as I mentioned earlier, we got some areas where some stuff is already happening. And Mercedes, do you want to talk about kind of, well, I think you and Allison, do you want to talk about kind of where things are, what's currently in the works here?
Yeah, I can kick us off, and then I think I hand it off to Allison.
Yeah.
Happy to do that. So as I sort of alluded to earlier, and Jason said, the good news is, while it feels like we lost time because we introduced our new 3-year plan in the midst of the pandemic and haven't been able to convene and engage with with you all to further the plan as much as we would have historically. That's actually not been the case, right? Like even in the midst of that, we've been able to advance some of the work under that we codified in the actual plan. And so we wanted to take a moment to highlight some of those things and before we shifted into what's next. And so if you're following along on your screen, we just called out some things that are currently in the works. And I think, Jason, we can actually, yeah. Actually, no, do you mind go back, Jason?
Oh, sorry.
No, that's okay. I forget what the upcoming slide is. So I'll pass it to Allison in a moment to provide a training update, because if you recall back under strategy number 4, the very first sub-strategy has an explicit focus around training, capacity building, and field professional development. So Allison will dive into that. You'll get an opportunity to hear from me around things that are brewing with regard to building our statewide and local race equity capacity. And then also hearing a bit more around the eviction diversion and actual homelessness prevention work that's been moving forward as well. So now I'll hand it off to Allison. Thanks, Allison.
Yep, thank you. So as we've stated a couple times, training did score second highest on the campaign survey that Jason mentioned earlier, as well as it being a point that we had added to the campaign action plan to begin with. So we know it's important for you to have access to evidence-based training to help continue the valuable work that you all do every day. But the campaign needs to hear from you. Training needs assessment will come out in the near future. So we really need you and encourage you to participate. So let's get more than 80. Let's beat the last survey, because we can't plan effectively and appropriately if we don't hear from you. So some examples of topics that we've heard from past information gathering that are actually listed in the statewide action plan are trauma-informed case management and supervision, housing first fidelity, harm reduction, and low barrier shelter practices. But we need to know what is most important and necessary from you, and we can't figure that out unless we get feedback from all of you. So please respond when you get the survey in the near future. We are going to have one more poll question for how you could get involved with this training planning. So would you be interested in participating in a statewide training coordination and planning committee? So that would be the folks that are working to move this action step forward for all of the stakeholders in the state. So this is not a commitment necessarily, just asking if you would be interested.
You took the words right out of my mouth. The polls are purposely set up as anonymous, so we have, I should have mentioned that with the first poll as well. We have no way to trace back, so those of you who are like, you're in that 50%, we're like, yeah, we're moving this stuff forward. We can't go back and see who you were. And the same is true here. So there is no commitment. It's not some kind of like pyramid scheme or something like that, where it's like, yeah, sign up today. And then, you know, for a low monthly premium of $4.99 a month, we'll keep you in the loop. This is more kind of taking the, like with that first poll question, taking the temperature, kind of seeing where folks are at. So let's see. Since I saw Allison's competitive nature come out already, there's already been more responses to this poll question than the first poll question. This might be slightly easier for folks to digest, but I think let's give it maybe another 10 or 15 seconds. We already have a pretty good response rate. And Allison can say that she got more respondents to her poll question than the previous one, so she gets a gold star. All right, you got like 5 seconds, and then we're gonna. So Allison, fascinating. We had 43% of folks said, yep, sign me up today. They're ready. So we gotta figure out, luckily we have an email list with everybody that's in the summit, so we can follow up and we can build out a committee afterwards. We know who all's here. So yeah. And yeah, so roughly like 2/3, kind of very modest breakdowns, like 2/3 think about it or no, but less than 20% were a hard no. So good information for us to have moving forward. So Mercedes, I think you're up.
I am. I think that's right. So we also, as I mentioned earlier, thank you, Allison, that was great. Wanted to really provide an update and information around the racial equity work that's been transpiring since we rolled out the plan. So Jason, I would say, Jason, I want to say during the virtual kickoff event, I know we probably have some overlap, but to Jason's earlier point, we have folks on this call who likely weren't with us. So I'll do just a quick recap. We shared at the virtual kickoff event that we have been convening behind the scenes. So folks who are connected to the campaign, State Department, CSH, MICA, and others, along with representatives across communities, have been convening to actually pull together a racial equity RFP. So the state through MISTA have committed financial resources to bringing in a consultant, one of our national consultants, to work with both the state of Michigan, so working with the campaign leadership, as well as doing work at the community level across Michigan to build our statewide and collective capacity around race equity. So we heard you loud and clear during the listening sessions. We have to do more than admire the problem, right? And lift up those inequities and disparities, and so we did just that. So that directly ties back and connects to both one of our guiding principles around proactively addressing, or actively rather addressing racial disparities, as well as the explicit sub-strategies contained under strategy number 4 of the actual 3-year action plan. And so our hope is, we've been convening the smaller working group. We've had conversations with consultant groups to better understand how this work has transpired in their actual experience across the country at the state level and also at the community level. We've also had conversations with many of you. So we had engaged with 4 communities that are already advancing race equity related work. And just a shameless plug, they do have a session later this afternoon if you're interested. 4 communities across the state have been doing race equity work. We brought them in, had conversations with them around the work that they've been doing to get a better sense of what our statewide needs could be in this particular area. So the hope is that we will be able to release an actual RFP out for consultants to respond to in the next couple months here, and have someone under contract and starting at the top of 2021, which would be really exciting. And what we're trying to do in real honor of advancing equity is kind of release any preconceived notions around what that work should look like, and really defer to the experts around what we need to do in Michigan based on their assessment of our data, both qualitative and quantitative, our policies and procedures, and just the overall work that they will do with both you all at the community level and the state leadership. So look for more there. There will absolutely be opportunities to get engaged and involved and have conversations with whatever consultant group is actually selected. And then very quickly, also wanted to highlight, I previewed this a little bit earlier, work has been transpiring in connection to eviction diversion with the statewide eviction diversion program and shelter diversion. So there'll be more opportunities for you all and want to just sort of get out into your radars, is we will absolutely be exploring opportunities, statewide opportunities to scale and replicate local diversion programs. There's a number of communities, Detroit in particular, Grand Rapids, the number of diversion pilots that were already getting off the ground or well established. I think Detroit has a couple of years under their belt at this point, where we're absolutely looking for opportunities to scale and replicate in other parts of the state based on the impact that the programs have had in the communities that have actually already been implementing those programs. So more to come on that front. And then also one thing that's probably top of mind for many of you, if you are at all connected to the statewide eviction diversion program implementation, is staff at MISTA are currently looking at evaluation related opportunities and encouraging communities to learn from their local implementation of the statewide EDP program. And then also obviously ongoing having conversations around sustainability. And I imagine those are also transpiring at the community level too, as those coronavirus relief funds expire at the end of this calendar year, assuming there's no continuation there. So, those are just things we wanted to note that are already brewing, but then also more to come in the future. I think that's it, Jason. Back to you.
If anybody's playing conference bingo, I just tried to talk on mute. First time this conference, so almost made it. So what comes next? That's obviously what Allison, Mercedes were already talking about. We have things that are already in process that we hope that you will get connected to as the opportunities become actualized. If that's the racial equity work, the training work, whatever it is. But as I said earlier, is going through the feedback from the survey, we also want to key in and look at the opportunities that this new action plan affords us. So, and I've shared a couple of additional responses that we got from the survey here. And, there was definitely a theme focused on accountability and kind of holding folks accountable at the state level, also holding folks accountable at the community level. So kind of this two-way street. So kind of keyed in on that. And then I think there's also questions about feedback. So for example, how are we communicating with one another? So how are folks at like the ICH or at the Policy Council communicating with folks in the field? And that was another kind of theme that emerged from the feedback we got from the survey, is what does that feedback loop look like, and what's the structure? So as we were putting this presentation together, and as I was kind of going through the survey results and talking with Allison and Mercedes and Christina, and kind of realized that I think one of the things that's starting to emerge as my role as coordinator for the campaign is almost like coordinator for all the COC coordinators, if that makes sense. And that part of what I hope to be able to do and aspire to do is get connected with stuff that's happening in communities across the state from, as a representative of the campaign. And part of that is keeping you in the loop. And that's part of what the survey, part of the findings that we didn't highlight is folks were like, yeah, we would like regular updates, send us emails, hold webinars, give us updates about what's happening with the campaign and in the strategies and the action plan, so that we're staying connected. And message received loud and clear. But at the same time, we also want to move that for the 50% of you that were like, who responded to that first poll question and said, we want to, but we need help. Or maybe we want to deepen our understanding about what kind of support you need. Full transparency, when we were initially kind of mapping out the presentation for today, we were going to dump a whole lot of stuff on you and say, this is what you need to do. But then we realized we kind of needed to take a step back because we weren't sure if that's what you really needed. For 50% of you, it sounds like we need to have some conversations about what that support could look like. For the 50% of you that are moving the work forward, we also want to talk to you as well. And we want to get a sense of, make sure that you don't feel like you're on your own with us. And that if there's supports, if there's help that you need, we want to be able to identify that and then figure out what that looks like. So if we can provide it, we will. So obviously I've got, so the next step here is, and this is kind of following up from what we launched at the kickoff. So kind of assuming that folks were there, and I realized that's not fair for everybody. So at the kickoff, we said we were going to do kind of a two-prong approach to getting feedback from folks in the field. One, we were going to do the survey. We've done that. We had a chance to go through the findings, obviously. And then after that, and after this kind of check-in during the summit, our next phase was going out and having kind of a second round of community conversations, kind of mimicking, we can't in scale and scope because we can't meet in person, but having some virtual conversations with folks, kind of following up the listening sessions we had when we were building the plan. And so, but now the focus is obviously on building support for the plan. It's with us for the next 3 years, and we want to make sure that it doesn't just end up on people's shelves or kind of people nodding to it and say, yeah, you know, the plan. We want to make sure that it's actually embedded in the work that you're doing. So that's what we want to do. So I've got number 4 here. What else? Obviously, the first 3 kind of built into or kind of emerged from the feedback we got from the survey, and I think from other conversations that have been happening. So take a pause here. I know that we've had some stuff popping up on chat. I haven't been able to see it, but I've been getting alerts that things have been popping up in chat. So Christina, I think maybe we'll pause here. And I know we're running over, and we've got breakouts kicking off here in about 10 minutes. But let's just check in with Christina on the stuff that's been coming in via chat and see if there's anything else that folks are identifying.
We haven't had anything specific come through on chat in response to this. I'm sure a lot of people are processing the information, and I think the poll questions have definitely helped to give us a sense of what people are thinking about.
Perfect. So, and the thing is, you know, these are going to be conversations. So it's not like we need answers today in the here and now, but this is more of a primer for you all to be thinking about that. So when you see invitations for community conversations coming out in the next couple of weeks, this is what, you know, we'll do our best to share questions ahead of time so that way folks aren't surprised. But these are the kinds of topics that we want folks thinking about. In the interim, if you do think of things, please feel free to reach out. I know my email address is out there. I've been getting, you've been getting pummeled with emails about the summit today and yesterday. So that was by design. We wanted to make sure you knew exactly what the game plan was. So I know everybody who's here today has my email address. So feel free to reach out to me if you think of anything else. So otherwise, I know we are actually 7 minutes over. So we apologize to everybody for keeping you around a little extra longer. But just want to say a huge thanks to the 250 of you who participated, and acknowledge that we appreciate the folks who responded to the survey, who responded to the poll questions today, and are out there doing the work and thinking about these big topics in the midst of, we're still in the midst of a pandemic. So you're thinking through the strategy stuff while you're still doing the day-to-day stuff you need to do. So with that, Allison, Mercedes, any other closing thoughts?
Thanks, folks, for joining on. Thanks, Jason and Allison.
Yep,
Yeah.
Thank you guys. I just echo thanks for all the work everyone does every day.
Yeah. So, all right. More to come soon, and on the action plan front. And I hope everybody is able to pivot over to the 10:45 breakouts. For that information, go back to the conference website, and you'll be able to get your links there. So, thanks all.